Good morning. Today is Thursday, March the 4th, and this is our weekly COVID-19 update briefing. As of this morning, today in Bossier Parish, we have an increase of 104 positive cases, making it 13,048 positive cases. We've also unfortunately experienced 5 more deaths in the parish, bringing our total to 264. At his Tuesday meeting on March the 2nd press conference, Governor Edwards announced that we are currently moving in the right direction and have been for several weeks. We've met the grading criteria to move into phase 3 of the recovery, which is effective from yesterday, March the 3rd, until March the 31st, and that is, of course, if it's extended by any subsequent proclamation or unless terminated sooner. The state's most recent percentage of positive cases is down. That's very good, and we are now at our goal of 5% or less. That's a big change, very positive. In phase 3, returning to phase 3, the key changes that the governor announced are the following. First, the majority of businesses, including restaurants and salons and most retailers, will be allowed to increase their occupancy from 50% to 75% of their capacity. Next, indoor gathering and event centers will be capped at 50% of capacity if they have a positive results of 5% or less for 2 consecutive weeks, but still limited to not more than 250 people. The third is that religious services have no capacity limits, but masks are required and social distancing is strongly encouraged. Bars statewide can reopen and with state approvals from the fire marshal's office can resume live indoor music. Event centers and indoor music venues can open at 50% of capacity or 250 people, whichever is greater. Gyms can remain at 50%, but stadiums and other sporting venues across the state will be allowed to open at 50% of capacity. Last Saturday, the Food and Drug Administration approved the Johnson & Johnson vaccine. This vaccine only requires one shot and does not require special refrigeration for shipment and storage. This was researched by a very mixed group of 40,000 people, and this vaccine was proven to be highly effective overall for preventing moderate to severe diseases. Of interest is the Archdiocese of New Orleans advised Roman Catholics that the J&J vaccine is morally compromised. It was suggested that due to its connection to abortion-derived cell lines, and it was suggested that Catholics should choose the Moderna or Pfizer vaccine if they were available and if there are no other vaccines with comparable safety and efficacy available. The impacts of the variants that are surfacing is not yet clearly known, but they are becoming a major problem. Some experts have said that vaccines are effective against these variants, but that more research is required. The Center for Disease Control indicated that variants from the United Kingdom and Africa are more contagious than the original virus. They transmit at a higher rate, resulting in more people being infected, going to hospitals, and regrettably more deaths. There's speculation that the UK variant may become the predominant strain by March of this year. Governor Edwards also recently included some different categories of people eligible for the vaccine, and they included persons aged 65 or older, first responders who serve as vaccinators, law enforcement and other first responders, dialysis providers and patients, ambulatory and outpatient providers and staff, behavioral health providers and staff, urgent care clinic providers and staff, and community care providers and staff. Also, the Louisiana Department of Health has announced that there's a limited amount of vaccines that are available to individuals in some new categories at select locations. and these include the following. First, for people with help with sign language and foreign language interpreters, health-related support personnel such as lab and mortuary staff, persons who are pregnant, individuals aged 55 to 64 with increased risk of severe illnesses from the virus. Legislators are now included, and the Louisiana Unified Command Group is now included as eligible, and also teachers and support staff of K-12 or daycare centers. Individuals in these categories must contact participating locations to make an appointment at that locations. And you should be advised, if you're doing this, to complete the Louisiana COVID-19 vaccine attestation form before the appointment. You are advised, do not arrive for an appointment without an appointment and without having completed that form. When using vaccines that require a second dose 3 or 4 weeks later, that appointment is normally made by and at the same location as the first dose. The projection for when the general population can obtain vaccination recently changed. It's now projected to be in the July-August timeframe. However, President Biden has recently announced that, last Tuesday, that the United States will have enough vaccines for every adult by the end of May. That's encouraging, and hopefully we can achieve that. He has also made a goal of vaccination for all teachers by May of this year. While we're in this pandemic, the federal government has confirmed that vaccines are available to those in need at no cost to the individual. It's estimated that only about 14% of Louisianans have received one shot of the vaccine, and about 8% have received both doses. But the demand still greatly exceeds supply. And as previously reported, it takes approximately 75 to 85% of the population being vaccinated to achieve herd immunity. And the effectiveness of the vaccine will be minimized if large numbers of people refuse the vaccination. And as we always point out, the numbers of people estimated to be asymptomatic is about 50%. They do not develop outward signs of the symptoms of the disease, but can have it and can transmit it to others, infecting family and friends, causing illnesses and death. The governor has recently strongly affirmed his directive that every individual in Louisiana, age 8 or older, shall wear a face covering covering both nose and the mouth when inside a commercial establishment or any other building or space open to the public, whether indoors or outdoors. And this also includes the public or commercial modes of transportation. The Center for Disease Control also recommends that children aged 2 to 7 wear masks. Governor Edwards continues to urge that we be good neighbors and voluntarily and consistently comply with the prevention and mitigation procedures. This will help us get through this period with minimum loss of lives and its impact on our citizens, and our national economy. The Center for Disease Control and the Louisiana Department of Health also have determined recently that the numbers of days that a person should remain in quarantine can be shortened to 10 days on day 11 if no symptoms have been reported during the daily monitoring period. They also say that the quarantine can be shortened to 7 days on day 8 if the individual takes a COVID-19 test and receives a negative result. It's hoped that these shorter quarantine periods will encourage more people to receive the vaccination. It's of interest to note that the Louisiana Department of Health still recommends 14 days quarantine for residents and staff of congregate living facilities and such as nursing homes and correctional facilities. Ladies and gentlemen, the prevention and mitigation recommended protocols have not changed. I'd like to review them every briefing, and they are as follows. First and foremost, wear a mask. Wash your hands at least 20 seconds. Social distance at least 6 feet. Do not touch your face, and disinfect surfaces that are such as doorknobs, handrails, etc. Cough or sneeze into the bend of your elbow. If you're sick, stay at home and follow the advice of your medical provider. And always, as always, avoid crowds. The pandemic is far from over, but the 3 vaccines that are now available are beginning to make a significant difference. But challenges remain, and it is going to take all of us continuing to follow these protocols to survive this pandemic with minimal effect. I just learned that recently, yesterday as a matter of fact, that the LSU Health COVID-19 vaccination team will be providing a large-scale community vaccination event at the Brookshire Grocery Arena in Bossier City, and that is at the former CenturyLink Center, now known as the Brookshire Grocery Arena. This will be this Saturday, March the 6th, from 9 a.m. to 4 p.m. Registration is required. So to get to register, you can go to the following link, all in lowercase, lsuhsc.edu. I'll repeat, all in lowercase, lsuhs.edu to register. I want to thank all of you for continuing to participate in our joint fight against this pandemic. I've noticed almost everybody's wearing a mask now, and that is a good thing. I urge you to continue. Our next briefing will be a week from now, Thursday, March 11th, and this concludes today's briefing. Thank you, and good day.